Hi, I'm Nick Mills, speaking with Dr. Michael Wyand. Dr. Wyand is the Chief Executive Officer of Oxeia Biopharmaceuticals. Clinical trials are underway for Oxeia's promising new therapeutic drug, OXE 103, aimed at treating concussions, also known as mild traumatic brain injuries. Dr. Wyand, how does a concussion happen, and how hard does somebody have to get knocked on the head, or how hard of a hit does your body need to take for a concussion to occur?
Well, thank you very much. Very, very happy to be with you here today and answering these questions. They're obviously critical for our program. And the question you just asked is a very important one. Uh, the brain, our brains are encased inside our skulls, so they're relatively invisible to us. And the types of injuries that can affect the brain, they could be a direct hit to the head. But many times what happens is there is a direct hit to the body, or the body stops suddenly. So you can think of a whiplash injury. And what all those injuries have in common is they cause the brain to bounce back and forth inside the hard skull and bang up against the sides of the skull. So it's not just the force of the injury, but it's also the speed at which the body moves its head back and forth. And so it can occur with a number of different forces from different directions, but we tend to think of those as being associated with sporting events, some of the contact sports, people falling downstairs, off bikes, off skateboards, and then of course the types of injuries that occur with car accidents, in which we typically associate whiplash.
So let's say that I get knocked on the head hard, and my body receives a hard enough jolt to cause a concussion. What happens then inside the brain?
So the brain, when it is either hit indirectly or directly and bounces on the skull, that action of bouncing sends shock waves through the brain. And what that does is it activates the electrical systems of the brain across the entire brain. And those electrical systems fire. The activation or hyperexcitation of the brain depletes the energy within the brain. So you can think of the brain in that situation like a battery. The whole brain has gone on and gotten excited, and the energy that's in the brain has been drained, and the battery is now drained. And so what happens is when the brain starts to function immediately after the injury, it's not able to function well. And that covers all aspects of what the brain does. It covers the way we think, our consciousness, knowing where we are. It affects our ability to walk and stand up and move and coordinate our bodies. It can make us nauseous. It can make us light sensitive. And we'll talk about some of those symptoms when we talk about the symptoms. But in effect, the initial injury is a depletion of energy in the brain, so the energy can't function. The other part of the injury that happens is that because the brain is kind of soft as it moves around inside the skull, it slightly stretches and deforms, which can affect some of the wiring. So some of the longer term consequences of concussion are due to this kind of stretching of the wiring. The wiring is not broken, but it's damaged to the point where it's not transmitting information like it normally should.
So then let me ask you this. What are the effects then on a patient of a concussion?
So the effects, as I just described it, what's going on inside the head, those effects are felt by the patient, and they're visible to someone who's watching, and we've seen this frequently in sporting events, an immediate onset of disorientation. The patient may have a difficult time standing up. When they do stand up, they're wobbly on their legs, they're not sure where they're going. And those are the initial symptoms. Those symptoms can last for a variable amount of time, depending upon the severity of the concussion. If those symptoms continue, then the effects on the patient are what we call post-concussion syndrome. And about 30% of patients will maintain some level of symptomatology out past 1 or 2 months. And sometimes that can last for many months, and sometimes it can continue on to years after the injury. But that 30% of the patients obviously are having prolonged symptoms that can affect them over a much longer period of time. So the old idea that, a concussion is not a severe injury, people tend to recover and their symptoms tend to dissipate, it really is something that is not true for those patients who suffer the long-term consequences, like I said, about that 30%.
Thank you, Dr. Wyand. In our next segment, we'll talk more about concussion symptoms. I'm Nick Mills.